If you don't know me, my name is I'm Dr. Curtis Coughlin in Colorado. I am focused on sorry about that. I am Our lab is focused on mainly metabolic epilepsies and organic acidurias. Most of our work has been focused on a couple of different disorders, including B6 responsive seizure disorders like PDE and non-ketotic hyperglycemia, which I see some NKH folks here on the call as well, or NKH. And to be honest, I'm going to keep this really short because I'd much rather hear Leah talk about her story in PDE than this grant. But we're very excited to put together a rare disease clinical research consortia grant. These grants have been around for 25 years. And really what they do is they are trying to pull together different experts to study rare diseases. The one that we are putting together is called the Infantile Treatable Inherited Metabolic Epilepsy Grant. I wonder if I could ask Christy to put that in the chat for us. And the reason it has such a long name is the acronym is In Time. And the goal of this grant is really two things. One, we really want to focus on making sure that we diagnose all of our kids as soon as possible. We want to make sure we diagnose them in time so that they get treatment, like standard of care treatment. So that's one of the reasons for the acronym. And then the real second focus of this grant is that we are working on clinical outcome measures for treatable metabolic epilepsies. So I don't think I specified in the beginning which metabolic epilepsies we are going to focus on, but we really hope if this is funded that this number of disorders will continue to grow. But the first four groups of conditions we're going to focus on are all of the B6 responsive seizure disorders with a primary focus on the three most common ones, which are PDE that due to mutations in the gene ALDH7A1, or sometimes you'll hear us call it PDE ALDH7A1. I know it just rolls off the tongue. And then PNPO deficiency, and then the gene that's involved for sort of keeping B6 moving around in the body or pyridoxal phosphate binding protein. So that's the first group of disorders. The second group of disorders we're going to focus on are the cerebral creatine deficiency disorders. There are also three of those disorders, GAMP deficiency, AGAT deficiency, and creatine transporter deficiency. We are going to focus on the glycine encephalopathies. The most common one is NKH that I already mentioned, but there are 10 other genetic disorders that also end up looking a lot like NKH. You have very similar seizures. You have some similar developmental and concerns. And then the last group of disorders will be the primary GABA encephalopathies, and the most common one of that is SSADH deficiency. So it's a whole lot of diseases where you have a metabolic problem. And one of the first things that people usually notice is seizures, but that seizures are not the entire story, that even when you control the seizures well, our children can get some other health problems, whether that be, difficult with school or learning, or sometimes difficult walking, or difficulty with speech. That most of the kids have some changes on MRI. And so we think by grouping these rare groups of conditions together that maybe we can learn from each other. We can learn things that we maybe didn't think about when we were just looking at one condition at a time. We're going to bring in some new experts. So many of you will know one or two or three of the clinician scientists on this grant, but not everyone. And what we really want to do is grow the number of clinicians and scientists who think about these diseases to make sure that there's even more smart people working together, thinking about our children and how we can help them. But by far, the most important thing about this grant is what we want to do is develop some very clear outcome measures to determine whether or not new therapies work. For all of these conditions, we have cured mice. We have cured them with gene therapy. We've cured them with enzyme replacement therapy. We have some new small drugs we've been given to mice. And man, we are so good at making mice's life better. But what we don't know is whether or not we can improve humans' lives, whether or not we can improve our children and adults' lives. And in the last couple of years, there have been a lot of very expensive rare disease trials where there was not a good outcome measure. And so even though it seemed like the drug improved those kids' lives, at least here in the US, the FDA did not approve the drug. We really have to have something objective that says that this medication really does work. And unfortunately, for all of these conditions that I mentioned, we are struggling with that. We cannot use biochemistry. So all of these disorders are metabolic diseases, and we talk a lot about biochemical metabolites, and we improve them. But at least in the US, that is not evidence that the FDA will use that drug makes this disease better. And so that is the real focus of this goal of this grant is we have an exciting amount of new therapies that we think are about to come to clinical trials. And so can we take kids who have very similar phenotypes? They look very similar. They all have metabolic diseases. Can we try to come up with a very clear outcome measure so that we can go to clinical trials and show, does one of these drugs that work in mice also work in kids? And that is the big goal of this grant. We are working with a whole lot of patient organizations. I think we just got 2 more that joined. I think we're up to 11. I don't know if that's the number you know, Christy, but we just got some letters from some organizations around the world. One from Italy, just got one from South America. Just groups of people who saying we've gotten a couple of letters from pharmaceutical companies that all say the same thing. Like, this is the need for our patient group. We want new treatments. We need outcome measures to show the new treatments work. So that was me talking for a really long period of time without taking a break. But that is the reason I'm happy to answer questions. This grant is due in a couple of weeks. We're really excited about the idea of pulling together these experts to think about how we can improve kids' lives. We won't know if the grant is funded for 6 or 7 months, which is the real big downside to how the US system works from grant funding. But the other thing I will say is that this has had a lot of experts talking to each other, and we've already talked about how we should start working on some things in September, take a few week break, and then start working together to really try to think about how we can improve lives of kids with metabolic epilepsies. So with that, I'm happy to take any questions, or if you just all want to hear Leah talk, I do too.
Curtis, can you briefly mention the survey that I will put into the chat, but also has been sent out?
Yeah, this is so wonderful. One thing we want to do is prove to the grant reviewers that families are also interested. I said we got a lot of letters from pharma companies and from other scientists, but if families don't care about this, then why would they fund it? And so there is a survey asking really like about your individual interest. Would you be involved in this grant? Would you travel to one of the 4 US sites to come? I will say one of our goals is to expand this out of the US. We have some ideas of people and organizations we will approach for philanthropy funding. I've been funded by one of these grants for 20 years, focused on urea cycle diseases, another metabolic disorder. And the Sloan Kettering Foundation tripled our funding from the NIH every year, and we were able to get sites all over Europe and Canada. So right now we're focused on 4 US sites, which are Colorado, at where I am at the University of Colorado, at Boston Children's Hospital, at Seattle Children's Hospital, and at UCLA. And really, the main reason that it is those 4 organizations is we think those are also the 4 leading clinician scientists in the US for this group of conditions. So please, if you could fill out the survey, it really just helps us show that families are interested, that they're also excited about this. And from what I've heard from the group, it sounds like we've had some nice uptake on the survey already.
Yeah, thanks so much. Do you guys have any questions for Curtis or Christy?
Nothing really, other than just obviously if there's anything else we can do besides filling out the survey to support this grant application, just let us know.
Yeah, Charlie, I mean, I recognize that it's harder when you're in Europe or in the UK. Are you in Europe? That's a good question.
I'm in the UK. Let's stick with that for now.
Yeah, let's not get too political about it. But and we've gotten some letters from individuals in the UK as well, just saying that at least from some of the groups I work with and your group specifically, just saying that this is something that's important. We support it. And just pointing out that yesterday we had a nice paper come out from the Great Ormond Street team and the Colorado team, if you didn't see it, Charlie.
Yeah, I did catch that. Dr. Nurse highlighted it obviously on the JMID. So yeah, about the can't even remember the marker's name, the 6-oxo. I'm butchering it. Sorry, but that
No,
one.
6-oxo-pipicolate or
That's
6-oxo-pip
it.
in urine, yeah.
Yeah.
And Leah asked the question, she said, can you guys share the survey? Absolutely, please share the survey with as many people as you can. And that way they're kind of also have the idea of this coming up in their mind if it gets funded, which obviously there's no guarantee. But the more folks we can get to do the survey, the better. So please share as much as you can, right, Curtis? Yeah. And always, I mean, Leah and anybody else, always feel free to share anything we have with whoever, whoever you can in your socials. It's, we only have a small reach, but through other folks, we can get to a lot more people. Okay. Anything else, guys, before we switch over to Liam? I'm not gonna stop